Traditionally, chemotherapy drugs are injected intravenously in a doctor's office or hospital. However, there are new effective chemo drugs which can be taken by mouth. In fact, more than a quarter of the 400 anti-cancer drugs being developed are oral drugs. However, health insurance companies treat intravenous drugs and oral drugs differently, often requiring the patient to pay a much higher copay for a drug in pill form. Here's tonight's Focus for the Cure.
When Susan Christoph was diagnosed in 2006 with stage 4 metastatic cancer, her doctor prescribed a very effective new oral chemotherapy called Ticur. But Susan's medical insurance company refused to pay for it because it came in pill form.
I would have had to pay out of pocket. It's $4,500.
Dr. Reshma Matani, an oncologist, has seen many patients struggle with this discrepancy.
The problem is that intravenous therapies are covered under a medical benefit, whereas oral chemotherapies are covered under pharmacy benefit. In the pharmacy benefit, patients are required to pay a proportion of the cost of the drug, and that can be considerable.
And oral chemo drugs that have an intravenous equivalent are covered too.
This drug, the Xeloda, would be paid for because there was an IV equivalent.
Susan told her insurance company she intended to fight the decision publicly.
I had had stories on the front page of the Palm Beach Post. I had been on Good Morning America about other insurance issues, and suddenly they just started delivering my drug.
Even though Susan now gets her oral chemo drugs, she is worried what will happen to other cancer patients if they have to pay a tremendously high copay of up to 50%, which can be thousands of dollars.
What would happen is they'd make a choice on a different type of therapy that's less effective, less targeted, and it would lead to early demise.
Susan G. Komen for the Cure is introducing new legislation which, if passed, would require insurance companies to pay for oral chemotherapy drugs the same way they pay for IV chemo agents. For more information, contact the Susan G. Komen for the Cure helpline. That number is 561-514-3020.